Next hand up is Steve Pickett. Steve, what do you got?
Judge, I just wanted you to, you touched on this yesterday. Can you explain to the public the initial concern to take this action? What is happening in this county right now regarding the public health that move you in this direction?
Yeah, great question, because we don't want to lose sight of the fact that this is not, parents versus Governor Abbott or Clay Jenkins versus Governor Abbott or the vaccinated versus the unvaccinated. This is all of us. We are all team public health, and the enemy is the virus. And right now, the enemy is winning. The enemy has retransformed itself into the Delta variant, where, Steve, when it first began, we had a replication factor called an R0 factor of 2. That means for every person that got sick, they could give it to 2 people. That quickly, with some distancing and hand washing, even before we understood about masks, frankly, that quickly got down into the low ones. But even in the low ones, when you got thousands of people getting sick, and for every 10,000, they're giving it to 12 or 14 or 16,000. It gets out of hand really, really quickly. But with the Delta, when we're seeing those huge surges, we were in the ones, 1.4, 1.5, 1.6. The Delta variant is spreading at an R0 factor of 5.0. So for every person that gets sick, 5 more people are getting sick. That's unprecedented. So you've got this unprecedented spread. The number, if you look at the sheer number of people in the hospital, the sheer number of people who are getting sick every day is not at the all-time high. But also what has happened, Steve, is our hospital staffing situation has deteriorated rapidly and from where we were 9 months ago. The governor pulled the order for temporary staffing while other states continued to lure people to do temporary staffing work. If you recall, for 2 weeks, the governor said, I'm not going to pay for that. You're going to have to get cities to pay for temporary staffing for their hospitals. The effect of all that was the scarce temporary staff that's out there has contracts with other states. And not only that, but the headhunters for those staffing companies were able to go to local hospitals and say, how would you like to make 2 or 3 times what you're making now to stay in a hotel room for a while and work somewhere else? So we've lost a lot of staff. And then finally, what's happened is people are burned out, and there are a lot of people that have taken early retirement. So when we look at our hospitals right now, Steve, what we see is a situation where, although there's not as many people in the hospital as there were at the very, very height of this, we're getting pretty close, unfortunately, but we're not quite there yet. We have a lot less beds that are available, because similar to tables in a restaurant, if you don't have staff to take care of things, you can't open the table. So you have a lot less beds that are available because you have a lot less staff. And that's a problem that will now be hopefully getting better now that the governor has reversed course on that and allowed those put those staffing contracts and that pay source back in place. But that'll take time. And we're trying to buy our hospital some time by doing everything that we all can do to get through this. And the 2 main things we can do is we can get vaccinated, and then we can wear our mask when we're in public settings. That's what the CDC says will give us our best chance to save some lives right now. Thank you for the question, Steve.